Distinguished members on the dais, Dr. Gyani, Dr. Bhatia, my colleague Mrs. Anju Sharma, Dr. Pandya, representatives of the various healthcare institutions in the state and in the city of Ahmedabad, representatives of various state governments, participants, learned participants of today's workshop, this conference here today, a very, very warm welcome to you from the Government of Gujarat, from the state of Gujarat. Before I came to this department, I had frankly not heard of NABH. I was wondering what is it all about when I joined, and there were people with lots of enthusiasm in the commissionerate who were saying under NABH we have done this, we have done that. Not really, I couldn't really get the hang of what it was all about. And after a few months, when I was traveling in one part of the state, going somewhere else for some other purpose, that somebody informed me, somebody who was there with me in the car, he informed me that India's first NABH accredited PHC is not far away from here. So I said, why not? Why not just make a surprise visit? So I didn't tell anybody, I just got some directions. Where is it? How far? Which turning? It's in a rural area in Baroda district. And I landed up over there. And it was a surprise visit, surprise in almost all ways. There was a team of doctors from Rajasthan who were there going through the facilities. They had come there to see it. And the doctor at the PHC, the staff, they were quite unaware that the Principal Secretary of the state is going to be dropping in unannounced and unprepared just to see what's it all about. So what did I observe? Other than infrastructure, in terms of some basic infrastructure facilities, the neatness, the cleanliness, the small things of a quality appearance which you see elsewhere were also there. All those, other than all that, on interaction with the staff over there, I could see a couple of very interesting things. I'd like to tell you, I was not unfamiliar with PHCs. When I was in the district, as a district collector or district development officer, I used to go very often to PHCs. So I had that image in my mind of about 15, 20 years ago. And now I have an image in my mind, I had an experience of this particular PHC at Gad Boryad, where I went and see neatness, cleanliness, neat labeling, and much more than that, I could see smiles on the faces of the staff. I could see confidence in their faces. I could see a kind of a surety in their talk and in their this thing, that in the domain knowledge, they couldn't be challenged. I spent about half an hour to 45 minutes going all over the PHC, talking to them, asking them what was the transformative experience all about. What was the situation prior to the process of NABH that they went through, and what was the situation after that. And believe me, I was impressed. Then I spoke to some of the patients also. There was satisfaction, a lot of satisfaction that yes, compared to the past, something good has happened, and we are happy with the way services are being delivered. So this is what it is all about. It is all about transformation. It is all about seeing that a very, very fundamental right which exists of quality health care for the Indian citizenry, that government is required to deliver a transformative experience for the citizens, and in the process involve, encourage, and transform the entire mechanism also, in terms of infrastructure, in terms of people. This is what it's all about. and standards have been created. I must say a very pioneering and a stellar role has been played by the Quality Council, the Government of India, that standards have been created, and I'm very happy to hear from Dr. Gyani that a lot more standards are getting created in various other fields, and the future that way is very, very clear. Today, we have 5 PHCs in the state which are NABH accredited. I'd look forward to a day, maybe not in my lifetime, hopefully so, but we would like to see all our 1100 plus PHCs NABH compliant. I would like to see all our 270 plus CHCs NABH accredited. I'd like to see all our sub-district hospitals, our district hospitals, our medical colleges. I understand there are no standards for medical colleges yet. I hope you will create them soon. We want to do things and be judged by objective and clear standards. It is important. It is important for the people, it is important for employees, it is important for society. And this is something which is a movement which needs to develop further. And we are looking at places which are not near cities, we are not looking at people who are living in cities, we are looking at employees, we are looking at citizens, we are looking at facilities which are spread all over in places which probably you would not like to go and spend more than a few hours in. And that is important, that we are looking at a uniform quality of service delivery all over the state. I don't know when this will all come about, but I do hope that this will come about, and today's conference here is very significant. Gujarat has done well, started doing well, but we are not unique. That we do all the good things in the world in healthcare happen only in Gujarat. That's not so. There are so many things happening all over the country. I was looking through the workshop program and a lot of experience sharing, good work being done all over the country. It's all going to be on the calendar today, on the table today. I'm sure the takeaway for each of you is going to be very, very good, very, very of a high order. And I must compliment those who are going to be speaking today. I would like to request them, make it simple, make it effective, and let people understand that there are things which are happening all over the state as well as in the country, which are replicable, which are doable, and which are strivable for all of us. And from the audience, I would like to request you, please ask questions, satisfy yourself that things are something which all of us can do. With these words, I'd like to welcome you once again to this workshop, to this conference, and hope that you have a very, very instructive day. Thank you. Thank you so very much.